So why did you get a low score in your USMLE Step 2 exam? All right, so the answer could be also for why did you flunk it the first time around, right? Or the Step 1 exam, why did you fail it? This could be a very important question in case you are in this situation. And this may not apply to a lot of people, but this would apply to a few people. So just make sure you have a reasonable answer for this very important question. Because if you flunked, if you fail or have a low score, you will be asked this question. You will be asked this question, okay? All right, I'm going to give you the bad answer as we normally do. And then I'm going to give you the good answer. And of course, you can check out the 50 plus answers, questions and answers, template answers, sample answers with my program. So make sure you don't miss out on the many other questions and answers that are in the program. Make sure you prepare well, okay? So this question, the bad unprepared answer, right? I guess I didn't study enough for that, for the Step 2 exam. I think I had a lot going on at that time. The exam was, of course, pretty tough as well. I probably could have done better. I'm not really sure what went wrong, but I do plan to do better in the USMLE Step 3. Okay, you can see this was not a good answer. Vague, unaccountable. You're not putting accountability or taking responsibility for your result. You're not really reflecting. You're not really showing that you learned some lessons from this, and you don't really have an action plan moving forward or anything that you did to address this issue moving forward, right? So now let's go over to a much more prepared answer and a good answer that you will be seeing with all the different answers that I'm providing in this program. Anyways, okay, the good answer. I do fully acknowledge that my USMLE Step 2 score was lower than I had aimed for. And I have been taking time to reflect on what actually led to this poor result, I would say. And during my preparation, just want to mention that I did face some unexpected personal challenges, though I do not like to put the blame on them, but I did have a few family emergencies. This did affect the amount of time I had to dedicate to my studies. However, I don't see this low score as a reflection of my overall abilities or potential as a physician. You can see many of my clinical evaluations have been very stellar. I do not feel that this overall score affects my potential as a physician. What's important is that I've learned valuable lessons from this experience. I took proactive steps to improve my study techniques further on, and as you see, I have passed my USMLE Step 3 exam, and I definitely made suitable adjustments, such as I had a much more structured study plan, and you can see the results. I'm confident that since I've also passed the USMLE Step 3 exam, that I have significantly improved my knowledge base and skills. So while the score wasn't what I had hoped for, I believe that my clinical experience, my commitment to growth, and my ability to learn from challenges make me a strong candidate for this residency program. And I'm definitely dedicated to continuing to improve and provide the best care for my patients. Thanks for asking this question. All right, so much more organized, did explain a little bit more. And if you did not pass your USMLE Step 3 exam because, you just didn't, you can say that, hey, after this low score, I actually hit the books and I have been preparing for my USMLE Step 3 exam. And just to let you know, I am actually doing much better in the assessment tests. And I hope to clear USMLE Step 3 before my residency starts. And I will surely be updating you on my progress in that. But thanks for asking this question. But I do know that this was a very important question for myself. So thank you for asking this question and giving me a chance to clarify. Thank you so much. Why this answer and the two variations that I gave you are good. You are taking a little bit of responsibility, that's one. Then you're giving a little bit of context that why you felt that you could not perform as well. And then you are demonstrating what you are doing or what you have did to rectify this or improve upon this. All right, you have or you actually rectified it by passing your USMLE Step 3, or you have a plan and you're actively working on this plan and you will keep them updated about your USMLE Step 3 before your residency. Of course, this largely applies to IMGs, but of course for US grads as well. Hopefully this helped, and in the next video, make sure you check out the framework and the do's and don'ts for asking this question. Make sure you check out the program in detail. Anyways, thank you. Bye-bye. You need some more help looking to connect, then I will have links in the description. and you can probably find my 25 questions and answers, a PDF. Give you the questions and the answers, and you can practice on your own. You need further help, you can check the link in the description as well. Possible sessions with small groups as well as possibly one-to-one. And if you want to become a member of my channel on YouTube, and we will be having live interview preparation sessions as well, consider becoming a member there as well. And of course, we'll chat over on Facebook as well. I will have all the links for all of my social handles in the description. Hopefully it helps. Thank you.